So first of all, lovely to see everybody here. And yes, not totally technologically challenged. I'd like to begin by acknowledging the lands on which we're coming from today. We here in Sydney are on the lands of the Gadigal people of the Eora Nation. And I'd like to pay my respects to the elders, past, present, and emerging. And I'd like to extend that to the lands on which everyone's coming from today. So I wonder if you would pop that into the chat to let us know where you're from. These lands are unceded, so was and always will be Aboriginal lands. Still letting people into the session. I'd also like to extend my respects to any and all Aboriginal and Torres Strait Islander people here today. I'd like to move it forward if that's possible. Thank you. So first of all, I just want to introduce myself to those of you who don't know me. My name's Lynn Monroe. I'm the convener of Warren Yara. You might tell from my accent, I'm English. I worked in England and Wales before moving in 2015 to Taiwan, where I set up a research centre in health professions education research. So I don't know if any of my friends from Chang'an are here. If they are, hello. I was going to try and use a bit of my Chinese, but it's so bad at the moment. I'm still practicing it to go back. And then I came here in 2019. I'm in terms of research, my research is in professional identities, and I'm a deputy editor of medical education, and I'm a specialty chief editor in Frontiers in Medicine and Health Professions Education section. And one of the reasons that I was wanting to run this workshop is because I think it's so important for people to get published nowadays. And quite often I'm on the receiving end of manuscripts. I also obviously write them, but I'm on the receiving end of manuscripts. And I often see things quite missing the point. And actually some research that could actually get published out there doesn't see the light of day in our publications because of this. So I'm going to begin by asking a question of you here, and also in the chat. I'm going to see if I can open up the chat and see what people are saying. But why do academic journals exist? Anyone in the room want to start and pop it into the chat if you can? Why do we have academic journals? Annette.
I guess to show what might be best practice or create discussion around certain topics as well, and put it out for the public to see.
Okay, so best practice, create discussions, and for public consumption. Well, that's pretty good. Anyone else want to add to that?
Share research.
Share research. Lilies.
Create new knowledge, or different ways of seeing the same thing.
Okay, so giving us different ways of seeing the same thing. And we've got Robert in the chat says to share knowledge. Okay, that's one reason. I'm just going to minimize the chat.
I think it also groups knowledge, and it also provides a history as well.
Yes,
so you can see how things have changed over time.
Yep, you've read my mind. So I think we've probably covered most of these here. So knowledge dissemination. So journals provide a platform for researchers, for us all, to share our findings with the community and the broader public. And this makes it available for review, for critique, and so that we can build on that knowledge. They also exist to facilitate a scholarly discussion, and they tend to be grouped into disciplines and subdisciplines. So they cater for specific academic communities. And within this, our publishing allows researchers to communicate with like-thinking researchers who are interested in the same topics as us. So our peers who've got a vested interest in this. Obviously, one of the things that we didn't really talk about is journals exist to ensure the quality, validity, reliability, and ethical standards of our published research. And even if we don't talk about ethics in our publications, there's always people in the back end of the journals who are checking that you've got ethics approval, that you've done things appropriately. And as has been highlighted just now, they're about curation. They are about, you know, they play an important part in archiving our research for future generations and putting together the most significant work in our particular fields. So essentially, academic journals exist to further the progression of science, arts, and scholarship by providing a platform for the dissemination, discussion, and archiving of academic work. They play a foundational role in the academic ecosystem, promoting the production of high-quality, impactful research. Okay, I'm going to bring up the online participants, or at least a few of you, because we're going to do a little exercise now. First of all, I'd like you all in the room and at home to clasp your hands. Has everyone done it? Yes, I can't. No, has everyone in orange done it? I'm not sure. Yeah, thank you. I'm checking on you. Those of you who have put your left thumb on the top, raise your hands. Okay, so you've put your left thumb on the top. You're the intellectual, creative, and sensitive people. Okay, don't change your thumbs. You're not allowed to do that. Those of you who've got the right thumbs on the top, raise your hands. Okay, you are the intellectual, reliable, and kind people. Well, you know. Now, I'm going to ask you to do something. Clasp your hands again. And now I'm going to ask you to swap them around and put if you're a left thumb top person, change it around and put your right thumb on the top. Do the whole clasping thing and try it. How do you feel?
Weird.
It doesn't feel right, does it? Okay, now, bear with me. We're gonna swap around. We're gonna do a bit of practice again. Here we go. We're gonna switch it around. Left, right, left, right. Do it with me. We want to do it at least 10 times. Okay. How's everyone doing at home or in your virtual rooms? Keep doing it. Now take your hands apart. Now I want you to this time try and clasp your hands with the opposite thumb on the top as a natural way of doing it. How does it feel? Better. Okay. Better. Today we are going to focus on the problem gap hook approach. I'm going to minimize this for our people at home. We're going to focus on the problem gap hook approach to orienting readers to your research. It's a different approach to the way that we usually do things, and it might feel like you're crossing your hands the wrong way, okay? But after a while, I promise you, it will become more comfortable and more natural. Okay, let's have a quick poll. I have developed a poll and I've never done this before myself. So I'm going to see if I can, I'm going to launch the poll for those of you online. Okay, I've got 3 questions. So the first question is, how many of you here have written a research manuscript? So let me ask for a show of hands in the room. Pretty much everybody. How many here have heard of the inverted triangle approach to writing a manuscript? A few? And how many here, or in our virtual space, have before this workshop came into your view, heard of the problem gap hook? Oh, that's nice. Okay, so we've got some. Let me end the poll and see share the results. What have we got online? Oh, can't see it. Anyone know how we
Scroll down. Scroll down on the right there. Okay,
so we can see that most people have written a manuscript. I'm actually surprised that only 37% of you have heard of the inverted triangle, but that's fair enough. And 44% have heard of the problem gap hook. Okay. So we have a few here who have used the problem gap hook or heard of it. Has anyone used it? I've got, okay. Would anyone like to give me, tell me how you found using it? Annette, I'm going to pick on you.
I think it's hard to stick to it.
Yeah. Okay.
But it's a good way to think about it before you write.
Yeah. Yeah.
I agree. I've found like you've looked at some I've attempted and you've moved things around, and when you move it around I can see, oh yeah, but to get that
it's actually a practice, isn't it?
Yes.
And we need to practice these things. So when you come out of this workshop, you're not going to be an expert in the problem gap hook. It's like a habit. It's like any habit. And if we're in the habit of writing in one way, how do you get rid of the habit? Is you put another habit in its place. And this is the habit that I think we should be putting in the place of our normal way of writing. So if, like me, you end up with at least a metaphorical version of the screwed up papers, like you write lots of drafts, you don't really like them, or your colleagues don't really like them, the feedback comes back, it's not quite right. One of the most powerful shifts you can make in scholarly writing is not to do with your own writing as such, it's to do with how you think about journals. So at the moment, we're all in this publish or perish situation, never ending. It just feels like we're always expected to, as soon as you've published one, before you've even done that, you've got to be on the next one. Sometimes we have multiple papers going at any one time. We don't even have time to celebrate our successes. These, PhD with publication, which I am a fan of, by the way. But it's easy to think that journals exist to publish our manuscripts. I mean, nobody said this at the beginning, and I'm quite surprised, but it's easy to think that you're there just to pick up my manuscript, but they're not. So they do publish scholarly manuscripts, but they're in service of much higher purposes. And primarily, the reason that I'm going to focus on in today's session is they exist to promote scholarly conversations. Okay, so this is the metaphor that we're going to look at today, the scholarly conversation. So in today's workshop, here's an overview of the workshop. I'm going to orient you to thinking about your paper as a contribution to the dynamic and sometimes, yes, impassioned conversation about a problem that exists in the world, and a problem that really matters. And as I said, I hope by the end of this, you'll be aware of the importance of this, but also that you'll have a few skills to take away with you. Just to let you know, halfway through, we're going to have a tiny comfort break, but anybody who needs to leave the room, please feel free to at any time. Well, I thought we were all reasonably familiar with the traditional inverted triangle introduction. So it kind of begins with a broad overview, and then proceeds through a series of, paragraphs that contain a literature summary that gradually focus, narrow into the research question that the manuscript considers. So that's why we call it the inverted triangle. And most of us, even if we haven't used this, this term, we've kind of internalized this structure from our kind of school days, and then probably brought it along to university for the essays that we write. That's where it comes from, and it appears in writing guides, including those for health researchers. So I did a quick check on the University of Sydney website, okay, and found this guideline for students under the study skills section. It clearly specifies that the introduction should have 3 main parts. The first being general information. So we start off with the general information, okay. And note, there's no mention of the big problem, the big picture, the big issue that we're trying to address. So this genre of writing has been schooled into us, and we continue to use this winning formula, whether we do it consciously or subconsciously, as we shift our writings from school to university and publishing in journals. And to illustrate, I'm going to talk to you, I'm going to show you some examples. So this is a Medical Education Journal, December 2022. This article on uncertainty tolerance, it was obviously an important topic. The editor thought it was going to be important. There was invited commentaries, and so it featured, it's a scoping review, and it featured in the journal alongside further, commentaries and editorials, etc. So we can see this conversational approach happening. It's important. The editor invited commentaries. Okay, so here's the introduction, and I'm just going to unpack it for you. So it begins, as we should begin, with a broad statement. Uncertainty, whether from increasingly complex disease states or conflicting clinical information, is inherent within the practice of medicine. Can't really argue with that. There's an evidence of application here. Subsequently, an ability for doctors to tolerate uncertainty is viewed as a key competency by regulating bodies. Okay, so uncertainty is an important thing, and it's a competency that doctors need to have. There's growing evidence that medical students and doctors with lower tolerance of uncertainty are at higher risk of reducing psychological well-being, including higher rates of burnout and stress. So it's really important for to know about this. I'm guessing the problem is, if you don't have high levels of tolerance and uncertainty, you might get burnt out and stressed. And then there's another problem coming up here about patients. So it's less clear, but studies suggest that reduced uncertainty tolerance in clinicians is related to, more tests, let's say, okay, which kind of causes potential distress and harm. So we still don't quite know what this paper is going to focus on. We've got a broad statement, we know it's important somewhere, and there's a number of problems, but we don't know quite what the problem is. And we have to really read down, because we then go into defining it. So you've got to be quite tenacious. You've got to read down and work out what's going on. Okay, here's another one. This was in this month's medical education. So this one is about entrustment supervision assessment tools. Just bear with me here. You don't need to know the topics to unpack what the message is here. So let's start again. Broad statement. Work-based assessments play a central role in assessing within medical education and provide unique insights into trainee performance on authentic professional tasks. Yes, great. Broad statement, can't disagree with that. In completing work-based assessments, clinical supervisors make subjective judgments about trainee performance. Although these judgments can generate nuanced and meaningful assessment data, they are also prone to biases which may threaten the reliability and validity of work-based assessments. Okay, so the problem probably is the problem that they're subjective, and what's actually the real problem here? Is that the problem? As an example, assessment scores often depend more on the assessor than the trainee's performance. Oh, okay, maybe that's the problem. Moreover, a significant portion of score variability may arise from assessors having different interpretations of the assessment tool rather than different judgments. Oh, it's a tool then. So I'm still not really sure what the problem is that we're addressing in this paper. Okay. So it continues. So why is this kind of writing outdated? Back in 1999, Crowley said that the problem is that it promotes a writing from nowhere. Okay, it lacks authentic purpose and a specific audience. So when you're a student in a classroom, you might feel that the inverted triangle is a good thing to do. I'm not saying it's not a good thing to do, right? What does it do for you as a student in the classroom? Who wants to give me a suggestion of why would you think this is great when you're in the classroom?
I guess when you're a student, you're just in a rush and you're trying to write an essay nice and quick, and it just gives you an easy structure.
Gives you an easy structure. Anything else?
You're not trying to like sell it as much as maybe with the journal. Like you need to get the time limited, and you need to get them quickly. Sort of like a
well, yeah, that's right. You're not actually selling it to a journal, are you? You're actually selling it to your tutor who's going to assess it. And what you want to do is you want to let that tutor know that you know everything there is to know about the topic. I remember doing this at university. I remember writing the most awful essay because I basically put everything I knew in it. And then I got a really bad mark and my tutor said, you didn't answer the question, you just told me everything you know. And I was like, damn, I thought it was such a good essay. But anyway, still, it's a great structure. And it kind of does the trick as a student. But scientific writers, we don't need to do that. We don't need to have this, kind of writing from nowhere. We're joining an ongoing conversation among scholars in our field. And these scholars care about similar problems to us. They really do, and they know it. We want to advance knowledge in that space. So what we want to be doing, the message we're giving, subtext that we're giving in that first paragraph is, hello, look at me, I know what I'm talking about. This is a problem we've all got a problem with, and I'm going to bring something to the table. I'm going to capture your attention. So using a broad general statement as an entree to an expert dissemination is, rarely a good strategy. At best, it uses up precious word counts. At worst, it can tire your reader, and it frequently gets skipped. I don't know how many of you read right from the top all the way down to the bottom. Like I'll read the opening paragraph and then I'll go, okay, let's get to the point. because I don't have time for this. Let's get down to the point. The time that I read the introduction is when I want to know more about a subject that I don't know much about, and that's fine. Maybe I'm coming to it new or semi-new or something. But as if somebody's writing about professional identities, I'll read that first bit and then I'll go, oh, good grief. I'll see who they're citing, and then I'll get down to the bottom and we get to the real nitty-gritty. But we have so effectively internalized this way of writing, broad down to the scope, narrow, that we are reluctant to change, but change is required. So, as I say, I'm just going to check the chat to see if anyone is. Just read the last sentence of the introduction. Jade said, yeah, yeah. Oh, what have I done? I'm with you on that one. Okay, so as I said at the beginning, the most powerful shift you can make is to, as a scholarly writer, is how you think about journals. They don't exist to publish our manuscripts. Kenneth Burke conceptualized academic writing as an unending conversation, a heated discussion in which any individual arrives late and probably departs early. By housing such contributions, journals facilitate a collaborative social process of knowledge building. And the conversation is becoming increasingly dynamic as an emerging genre of invited commentaries, of blogs, of video abstracts, of infographics, of podcasts accompany our writing. It's much more of a conversation that we're having. So many of us actually probably identify with being a conversationalist rather than a scholarly writer. We might go, well, we've had a lot more experience of it, haven't we? So imagine that you're not writing a manuscript. Imagine you're joining a conversation at a social event. So what do you do at a social event? If you're like me, you kind of hang about and you do a bit of eavesdropping, you think, oh, what are they talking about? What's going on here? You get the gist of what's happening. You slightly awkwardly at the side. I'm kind of interested in this myself. I'd like to join the conversation. And then you kind of signal your interest in this. Oh, this is interesting. Yeah, I'm really interested in this. And I know a bit about this, and and then you want to join that conversation. You just kind of get in there, and then you signal your intention to add something new when you open your mouth to speak. And you hope that what you're going to say will matter to those people around you because you've hung around a bit and you've listened to what they're saying. But when you violate those expectations, and you just sort of blurt something out, you just say something general or something, well, people just like, what's going on? Who's she? They'll back away. They won't want to encourage you to continue. So, think about that social etiquette that you have. And most people get it right most of the time, but we don't always apply our social intelligence to scientific communication. But the argument here is that we should. Okay. So the conversational metaphor changes our customary notion of what the introduction of a scholarly paper might accomplish. So position your work as compelling conversational turn. Your introduction needs to do 3 key things. You need to be able to identify a problem in the world that people are talking about. You need to establish a gap in the current knowledge or thinking about the problem. And we're really quite used to getting the gap bit, right? And then we need to articulate the hook. The hook convinces your reader that this gap matters, that we should care about it. And ideally, all 3, if you can, should be in the first paragraph. I mean, sometimes I'll do it and it'll be the second, it'll come in because I want to say too much. I always want to say too much. And the other thing about it is you don't need to say too much in the first paragraph to orient the right reader. People will usually forgive you and go to the second paragraph if they don't know what you're talking about, okay? But you'll usually hook someone in because you'll be telling them this matters. Okay, so let's take a look at another article. This is, again, back in December 2022, the same edition that the uncertainty paper was in. This is on the subject of character-based leadership in medicine. Okay, here's the introductory paragraph. Problem. Physician leadership is multifaceted, but leadership training in medicine is often not. Leadership education and training for physicians are rarely grounded in conceptual leadership frameworks and suffer from a primary focus on cognitive leadership domains. Character-based leadership is a conceptual leadership framework that moves beyond cognitive competencies and articulates dimensions of character that promotes effective leadership. Okay, so essentially it's saying leadership training is rarely grounded in conceptual leadership frameworks, so that fails to promote effective leadership in the same way as character-based leadership has proven to do in the domain of business. Sorry, didn't get to that, although character-based leadership is a well-recognized approach in the domain of business. Going too fast. So the gap is, we know very little about how character-based leadership translates into the distinctive space of effective physician leadership. So we've got no evidence of how it translates. Why is this important? Well, understanding the potential of application of character-based leadership in the medical context may help lay the foundation for more robust physician leadership education and training. This is the hook. We need to know more because it might lay these foundations for robust physician leadership training. Okay, now note the next sentence, the first sentence of the second paragraph, is what most papers would start with. Leadership is increasingly recognized as an essential medical competency. Okay, do we see that? That would be what most of them start with. This is a little bit convoluted. It's probably not the best example, but I'll move to others too. But seriously, this one takes the problem gap hook in the first paragraph, and then it goes back into, and you can then go back into something a bit more general because you've captured someone's interest. Oh, wow, this really matters. Okay, for those of you who are not medical educationalists, I know that some of you are not, it's equally applicable to the vast majority of research that we do. So this is the Journal of Pain and Symptom Management. It's November 2017. Here's an example of, so this is about existential dimensions of conversations with patients at risk of dying from heart failure. Wow. Quite a lot to do on a Thursday. So the introduction starts with a problem that providers struggle to navigate communication related to dying and death for patients with chronic illnesses such as heart rate failure. There's a little bit of a space here where recent discussions articulate communication barriers that must be overcome to systemize and improve decision making at the end of life. The gap is that we don't, heart failure patients, caregivers, and healthcare providers remain largely reluctant to communicate about disease progression, prognosis, expectations for future care, death and dying, and palliative care. With a growing population, why is this important that we deal with this? There's a growing population facing, of patients facing life-altering healthcare choices to the context of chronic fatal illnesses like heart failure. So we need to better understand this continuing elusiveness of meaningful and productive discussions for care at the end of life. So now they've actually said this is like, we're talking about heart failure, but now this is actually more about even more patients than just heart failure patients. So that hook is even stronger hook than the beginning problem that we talked about. And here's one more, which is in a surgical journal. So this is this ALPPS. Now, I actually don't know what ALPPS means. It doesn't really matter for this example, because we'll see that how the structure plays out. Controversial. I mean, I would say you should define what you're saying in the first sentence, but let's not pick at this. Controversial since its first description in 2012, the ALPPS procedure has demonstrated impressive accelerated liver hypertrophy and expansion of respectability for high liver tumor load, as well as unacceptability, high morbidity and mortality. Inconsistent results plague the procedure. That's the main problem. So we've got this procedure, but it's inconsistent. Some reports say the mortality rates are higher and others say no mortality. The gap is we don't know why we're getting inconsistent results. And the hook is this information might be the first step in achieving an acceptable multi-center morbidity and mortality through international standardization of patient selection, indications and surgical technique. That's a really important reason why we need to know why is it all uncertain. Interestingly, the problem gap hook here accommodates itself around the need for this journal's insistence that in the first paragraph you say what your hypothesis is. So just above there, our group hypothesized that. So it can be moved around a bit, and you can add bits in that if you've got a journal that wants you to do certain things or that you want to put certain things in, it can be part of your narrative in that introduction. Okay, so tips for effective problem gap hook. We're going to be moving to a break soon after questions and answers. A quick comfort break, very quick. Let's see where are we at? Oh, we're doing quite well for time. So here's a few tips. The problem that you're exploring is not the same as the topic. The problem has a greater sense of urgency. So, for example, the topic, team communication plays an important role in patient safety. That's kind of your general, that would be your general kind of start, wouldn't it? The problem, adverse events resulting from error happen at unacceptably high rates in hospitals, and ineffective communication among team members is often a contributing factor. You feel, oh my goodness me, that's a problem. You know, I know team communication is important for patient safety, that speaks to us, but the problem really moves us, makes us think something's happening. Your exploring is not the same as your research question. So while a clear research question is, and purpose for your work is really, really important, that's not the problem either, okay? So it's not the most powerful way to get yourself into a scholarly conversation. And finally, when crafting your hook, it can be negative or it can be positively phrased. So you could say, so without doing X, this might happen, which would be a negatively phrased. You know, if we're not attentive to this, we could be, you know, that's a negative phrase. Or you could say, if we attend to this, we can do this. This is what's possible. Okay. We could say, you know, until we understand, blah, 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 then, blah, blah, blah. Okay. So you're getting the picture. Okay. You can negatively frame it, you can positively frame it. And it really does depend on the rest of your, you know, how you're framing your initial kind of problem gap hook. One of those ways will feel natural to you. It will come to you. So I've asked my colleague Rizka online if she could field some of the chat to see if there's any questions in the chat that are coming up. Rizka, I don't know if can our participants unmute themselves? I'm not muted. Hi, Rizka's there. Hi, Rizka.
Hi, Prof. Lynn.
Okay, so everyone who's online, if you want to put any questions in the chat, Rizka will read them and then she'll post them to me, or she'll ask you to post them, and any questions in the room. So I'll start with the room because we don't have anything in the chat yet. Yes.
Comparing the inverted triangle with the problem gap hook, would you say that the problem gap hook introduction tends to be quite shorter, like shorter,
Yeah.
more articulate compared to?
Okay, so sorry, do you want to say your name?
I'm Sasha.
Sasha. Sasha said comparing the problem gap hook, I don't know if you can hear okay online, comparing the problem gap hook, it is short, is it shorter or more concise? It's okay, so the inverted triangle is not something you necessarily need to completely throw away. Okay, the problem gap hook is your opening paragraph. The problem gap hook is, if we think about that conversation, you know, while you're hanging around, you know, you're hearing what's going on. That's kind of the literature review bit. Okay, so you're hearing what's going on. Oh, this is happening, that's happening. Now I need to make my entry into this conversation. You then start your problem gap hook entry. At that point, you hope you will have captured the editor's audience, the editor's attention, you know, because that's one of the people that you're writing for, to get through editors, your peer reviewers, etc. You're capturing all of that there. But then you do also need, unlike a cocktail conversation where you're showing that you're interested in something, you do then need to go into a little bit more of the detail. So then you might go into the some of the key elements that are going on. I would say you wouldn't start as broad, although we did see one paper, and this is all personal style, and it depends on what you're actually achieving in your paper. But you can start off with the inverted triangle underneath. I would say probably don't. I would say be more focused. But the problem gap hook is just a single paragraph, and that's all we're focusing on today. Happy to do a workshop on other bits of your paper, but that's all we're focusing on. It is just grabbing the attention. You know, say, look, hey, look, this is an important thing for you to read. And it's usually actually quite good then in that scholarly conversation for you to use, you know, if someone interviews you for a podcast, for example, you might want to start off that way. You might want to pop that in your abstract as well. Get people right up front thinking about it. But also don't forget, you need to be following that through your paper as well. Okay, any other questions in the room? Because we're all going to have a go at this in a moment, and I'm really excited. That's the point of being here. Okay, we've got more questions coming up afterwards. Probably more questions when you've had a go. Yeah, great. Okay. We've just seen Jade's posted something online, and she says, as an editor, how different is the experience for you to read a paper with the problem gap hook intro versus a paper without? As an editor, it's really lovely to see it. as an editor, you know, when you read, because as an editor, you like what frontiers in medicine, we get a lot. And as specialty editors, we have to kind of like sift through them all and say, you know, is this publishable? Is it not? It's rare that we get something that hits you, that really makes you think, oh, wow, I want to publish. You know, you actually think, I want this in my journal. This is what I want. In medical education, as a deputy editor, I'm the second person to get it. But also, again, you try not to be, you know, as an editor, you try not to be terribly pro or not your paper, because you want to see what the reviewers are going to say. But also, as an editor, you're a reviewer too. And so when I see something like that, that screams out, you know what, this paper, you're actually missing the real issue here. You know, there's something going on that's bigger than what you're thinking, and you haven't thought about it. You're not joining that wider conversation. You're too narrow. I would, depending on what other people are saying, whether it looks like it's a rigorous paper, I would say go away. I put it in my reflections in my review, and I'd say go away and rewrite this, rethink about this. You know, we think there's promise, but it's not, you know, you're not there yet. So definitely I would encourage that in as an editor. So thanks for that question, Jade. This is groups of 3. Okay, so I'm going to, those of you we're all comfortably in 3. In fact, we're all comfortably in 3s almost, you know, I think, in the room. So that's great. I'm going to put you into breakout rooms clunkily, because then you'll see how good I am at this in a moment, those of you online and those of you here. I'm going to ask maybe a couple of groups of 3 to go outside, and if there's space outside for you to have your chats, because it will get very, very noisy here. What I want you to do is think about your thesis project or your research project or your grant application, or, you know, your assessment that you're doing, if you're doing something, you know, it's a project that you're doing. And I want you to think about how you can articulate this, thinking about the problem gap hook. Now there's three of you in each of the sessions, and I want you to have 5 minutes each and tell each other your problem gap hook. So that just gives you like 5 minutes to kind of like articulate it, and you may not quite articulate it because it really only takes 1 minute if you know what it is. So I want you to start thinking about it and talking about it, but 5 minutes per person. Introduce yourself in that 5 minutes. Don't do it all up front, because that will just take up valuable time. Just say who you are and what the topic is, and we can do it like that. Okay, so we've got 5 minutes each per person in a breakout room, and at the end of 15 minutes, that's going to help you formulate it in your own head. Okay, then we're going to do individual tasks where you'll be writing it. So this is just a kind of like a brainstormy bit. Okay, so we're all ready to go then. Yes, or do we have any more questions? I'm going to ask you, if you're online, pop your question into the meeting chat. Meanwhile, anyone here, stick your hand up. Let's kind of, because actually when you start to do it yourself and articulate it, the questions are coming. So do we have any questions?
It's not a question, but more of an observation, in that when I'm thinking about my thesis as a whole, there's a problem gap hook. But when I'm actually thinking, because I'm doing mine with publications, I've got all these different papers, and each of those have got a problem gap hook that is a smaller part of that problem gap hook of the thesis. And it's quite hard to kind of although maybe your problem might be similar for each, but the gap that you're addressing
would be more specific
Yeah, right.
for each paper. And the hook will be also more specific to that gap.
Yeah.
Now you're all ready for a quiet, focused time. So you need to complete the following sentence to draft a paragraph. So the problem is, well, you don't say the problem is, but you know, the problem is nod to the known. You can give us a nod to the known if you, what we know is, but you don't have to do that nod to the known, that's optional. What we don't know is, and this matters because, okay. Okay, so has everyone finished? That was a very satisfying, it was quite a zen 8 minutes for me, hearing all these clicking of, of computers. I nearly said typewriters, it just shows my age. Computer keyboards in a very rhythmic way. And hopefully everyone online was also feeling, you know, like you were getting into the zone. What I'm going to do now is I'm going to suggest that we now break out into groups of 2. So let me get my PowerPoint slide so it's in line with what we're doing. I prefer 2 rather than 3 because I think it's much easier to have a conversation in 2, and we only will have about 5 minutes. So break out in the room with, find someone who you haven't spoken, maybe find someone new who you haven't spoken to. I've randomly assigned you to a breakout room online. And the idea here is to get some peer feedback. So you've got about 2.5 minutes each to talk about your problem gap hook, and your partner to give you some feedback. In that 2.5 minutes, I want you to introduce yourself. So let's not do it up front. Let's just go straight in there. It'd be great if you met someone you haven't met before. And then I'm going to tell you when the 2.5 minutes is up, and then we'll swap around and it'll be the next person. Does everybody understand what we're doing? Simple, peer feedback. Off you go, 2.5 minutes. Okay, so the next bit is I thought we'd do a little bit of feedback to the big group. I'm just going to Jade.
Hello.
Online, Jade. Hi, Jade.
Hi.
I don't know if you can see me wherever I don't know where
I can see you waving. Hi.
Hi.
Let me read out the quick edited version.
Yes.
The problem, we strive for patient-centered care, but we don't have patient-centered data or patient-centered guidelines when multimorbidity is the norm for some conditions. When multidisciplinary care is recommended, that's often little more than a platitude with no practical guidance when complex patients have been excluded from the data that informs the guidelines. The gap, people don't know how to deal with the complexity. And when we don't know what helps or harms or how to set priorities with complex pain management, if we knew that, we could reduce the lack of communication between providers, reduce the diagnostic delay, and prevent people from slipping through the cracks, and streamline systems to redesign care for the people who need it and use it most.
Wow, great research that we're all doing. I'm just going to say, well, we should add another hour on so everyone can tell us about their research. Okay, so again, I think my feedback would be the problem sounds like a problem, but that whole complexity bit, I still want to know the so what, the whole so what. You know, what's happening to these patients if it's not being.
Yeah, I skipped over the what we know bit, which I think has that in it.
So I think we need a little bit of urgency in the problem. Again, and I think, I do feel that I don't know this area. So you may say, no, that's urgent, and we'll all know it. In whoever's working in this area knows that's the urgency. So I'm just saying, I think it's difficult because it almost feels like we're being quite dramatic when we promote the urgency. But I feel like that urgency is important.
Would stating that with multimorbidity, life expectancy is 15 to 26 years shorter than without?
Yes. Oh my goodness.
So that sentence as well? Okay.
That's urgent. Yes, that would get me. That would really get me. Rizka, you're hovering and I can see there's some chat. So is it because we've got people a question?
Yes, Proflin, we have one question. So it's from Pippi. Our last breakout session led us to the question of whether the problem gap and hook should be relatively in terms of word count, or is this not important?
Depends how long you can span a paragraph, really. And also, you don't want to lose your reader in that time. You want your reader to stay with you. You know, it can go over 2 paragraphs, right? But I would say if you can do it in a single paragraph, do it in a single paragraph. I have problem. I'm a wordy person. I use too many words, I know. But you know what can happen is someone else can edit it down for you. If you're working in a team, you can get someone else to do that. So I think that's where I'm at. And now we're about 2 minutes to the hour. So I'm going to start wrapping up, and I really apologize for wrapping up so swiftly. I guess what I want to say before we finish is, do you remember I said it's not going to be easy, but the more we do it, the more it will become second nature, and we start to think about this. There's no hard and fast rule. This is your introduction. This is your entry. You know your peers. Warn your supervisors and colleagues that you're going to do this, because they might go, oh, what's going on? You just crossed your fingers in a different way, and I feel a bit put off. And it's a great way to start a grant application. Just want to say. The other thing is, any of you who are not members of Waranyara, please become a member. I think we might be getting something in the chat for you to join, give us some feedback on the workshop. We're going to be doing some more workshops next year. I'm developing a series of workshops looking at going from the research process right from the start all the way through different research perspectives and all the way through to publishing and impact, etc. So join Waranyara, because you could be part of those workshops and also be part of the community to give us feedback and join us, and we're all good fun here. And I'm just going to say thank you very much, because we're on time, a bit too tight. Thank you.